Good evening, everyone. My name is Emily Higdon, and my special population that I have selected are pediatric burn survivors. When discussing this population, it is important to remember that these children are not victims, they are survivors. I selected this population because I have a special connection to children who are burned, as a result of my time volunteering with children who have been burned. Pediatric burn survivors are more vulnerable in the healthcare system as a result of their age. A majority of children who are burned receive their burn injuries under the age of 5. When children are burned at such a young age, they are more susceptible to requiring additional treatment after their initial treatment in the hospital right after their injury. These additional treatments could include, but are not limited to, skin release surgeries, physical, occupational, and/or respiratory therapy, as well as multiple follow-ups to ensure the wounds are healing properly. All of these possibilities predispose pediatric burn survivors to various mental conditions such as PTSD, as well as a lower quality of life. When a child enters the burn unit, the initial priority of the healthcare professionals is to prevent infection of the open wound. While they are in the hospital, children will receive treatment for their burns through dressings in order to prevent swelling and infection. The burns will be dressed in sterile gauze and changed routinely. After a child's burns have been healed and the swelling has deceased from the wounds, the child will move into the next stage of burn wound care. This stage will include the child getting properly fitted for compression garments, as well as assessing if the child requires any further skin grafting. Compression sleeves are disliked by many children because they may feel that they will stand out even more among their peers, especially if a child has sustained burns to their face and requires facial compression garments. A burn survivor's stay in a hospital can be a stressful time for a child. There are large amounts of pain, they're constantly being touched by people that they don't know, and their bodies have been changed forever. During this stressful time, it is our job as healthcare professionals to step up and help their journey to be as easy as possible, even after they leave the hospital. After enduring such a traumatic event as being burned, a child may develop post-traumatic stress disorder or PTSD. It is important to talk to the child about how they are feeling and talk to the family as well, so that they know how to properly care for their child if PTSD does develop. Psychological problems can be easily overlooked when dealing with a child's physical injuries and well-being. Once the patient's condition is stable, it is then time to look and see if there are any underlying problems that we may have missed initially, so the child does not fall victim to these problems later on, because it is easy for these to develop and that we don't know, and they will grow and continue to grow and be with this child as they get older. Once a child has been released from the hospital after their initial stay, it is the responsibility of taking care of the child that falls more heavily on the parents or guardians of the child. It is imperative that the guardian of the child has taken into account all of the needs of the child and all of their future needs. These needs might include medications, a ramp if the child is using a wheelchair, therapists that they may have, rather than be physical, occupational, or respiratory therapists, or possibly even a home care nurse. A parent may overlook the need for emotional support just because they're so focused on the physical needs of the child. And depending on the age of the child may not know that they also need emotional help, or they don't know how to ask for it. By making emotional support well known to the parent and having it readily available for the parent and the child, we can increase the likelihood that the child will receive this help, because the parents will also need this help coping on how to help their child who has sustained such serious injuries. There are many programs and support groups specifically offered for pediatric burn survivors so that they can meet people who are just like them and realize that they are not alone in their new world as a burn survivor. Receiving traumatic injuries that leave physical scars for any person would be traumatizing. However, when a child sustains these injuries, it is more traumatic living with these scars. Many young survivors feel as though they are alone when coping with their injuries. They are often stared at, and some are even bullied because of their physical scars. These harmful remarks from others can have an even deeper psychological impact on these young survivors. When a child is around these kinds of negative remarks from peers on a daily basis, it can severely reduce their quality of life and wonder why this happened to them, and cause them to feel almost burdened because of their injuries and feel that they caused this to themselves. No child should put this kind of guilt on themselves, and this is why psychological help is so important to improve the quality of life of this child. At that moment, whenever they're burned, they don't know what their next step in life is going to be. They don't know how they're going to fit in society anymore, and they question these things. And with help, they can see that they are not alone and that they are like everybody else, and they can have a normal childhood just as they lived before their injury. So, as you can tell, it is just as important to focus on a child's psychological needs as well as their physical needs. A child deserves to be a child without having to worry about what other people think about them or their scars. And a person should not be defined based on their physical appearance and their scars. On that note, I would like to leave you with these final thoughts. How could hospitals and rehab facilities provide psychological care for a child without making them feel awkward about it, without making them feel awkward for asking for help? Should the family be included with getting psychological help with their child?